I'm in sad shape. Wait a minute. Before you begin, I must ask that you pay in advance. 5 cents, please.
Oh man, if you find yourself feeling blue like Charlie Brown these days, you are not alone. About 10% of Minnesotans experience seasonal affective disorder, or also known as SAD. Dr. Karin Ryan, a psychologist with Nystrom and Associates, is here to talk about SAD. Now, I used to be a health reporter, full disclosure, so I know quite a bit about this disorder, but I think a lot of people don't understand how it might be different than just feeling a little down. Tell us how this is different.
Yeah, we've heard winter blues or just having a funk, but seasonal affective disorder is really a type of depression, and so you're meeting criteria for a depressive disorder. And then there's some key characteristics that make it a little different or make it stand out, so that's when you know it's SAD.
Okay, all right, what are those characteristics?
They are, typically, it starts fall and goes through winter, right? So we think of those dark winter months. And again, they're those typical depressive symptoms, so feeling down, more tearful, lower self-esteem, kind of feeling more irritable, sleep difficulties. But what we find in particular is it kind of feels like you're glued to the couch. Right? Yes. Instead of appetite changes, oftentimes increased appetite and some weight gain, and just feeling like you cannot do the things you normally would enjoy.
You think about, like, I come home from work, I put my pajamas on, I want to veg out because it's cold out, I just want to be inside. That's different than being just stuck to the couch, not being able to go outside and enjoy the things that you normally could during this time of year.
Exactly, where it really is impeding your functioning. You're not able to do those things that you would normally enjoy. Where sometimes it's hard and you're like, oh, but I'll do it anyways, where it's you really can't and you're finding yourself really stuck and feeling down most of the days.
Okay, so now in Minnesota, right now, December is what the cloudiest month of the year, and it's so dark, so early. Is this why we in Minnesota feel this even greater?
Yes, it's why we get that 10% ratio, and some people have like 5%, because when we're in the northern hemisphere, right, our days are shorter. We are simply experiencing less sunlight, and we know when we get less sunlight, that impacts our serotonin levels, which are those chemicals in our brain that have a huge impact on our mood, right? And then the shortened days impact our circadian rhythms or our sleep cycles, so that gets off, and that impacts our melatonin and our mood as well. So we've kind of got this trifecta, and then it's cold, and so it's unpleasant, and so we've got this trifecta, and with COVID, we're seeing more and more seasonal affective disorder.
Why do we live here?
Because the good people we love are here. That's my reason.
Like, that's true. Okay, speaking of the good people we love and finding that support is so important. We may think, you know, once the season is over, I'll bounce back. But why is it important to get the support you need during the time you're feeling down?
Yes, like we're going to white knuckle it through the whole winter. And winter here is 4 months long.
It's the longest season of the year.
Yes, we deserve to feel better.
Right,
and we deserve that support. And so it's when you recognize these signs and symptoms, get help, because there are effective treatments for it. Right, so like we talked about, those serotonin levels get impacted, so we know antidepressants that impact serotonin levels are helpful, and SSRI. We know that therapy is helpful, right, because it's someone to talk to, it's someone to implement some of those behavioral and cognitive changes, which we know are so helpful. And there's also light therapy.
I've heard of this.
Yeah, it's a light box, so it's a specific light that is full spectrum meaning
so not like a lamp.
Not like this guy, I can't sit under here.
Right.
It's a specific box that you get, light box, that is the full spectrum, and it mimics sunlight, but it takes out UV rays. And so that really helps, especially if you utilize it in the morning, getting those circadian rhythms, melatonin levels back on track.
Okay, if we want to boost our mood in maybe a different way, maybe medication isn't the route right now, what are some things that we can do today, tomorrow morning when we get up, to kind of start on the right foot?
Yeah, and I like these because they're good for winter blues, they're good for the hard days, and they're good for the true seasonal affective disorder. So you think about, one of the things I like is set a positive or something that you can look forward to each week. So it might be, on the weekend, I'm going to go to Sam's. On the weekend, I'm going to go sledding. On the weekend, I'm going to make cookies. And so you're setting that plan, you have something to look forward to, right? Those are things that kind of keep us hanging in there. It's also things like opening the blinds and making sure sunlight's coming in. I know people hate to hear it, but get outside.
Yes.
5 minutes.
Take a walk.
10 minutes, right down the block. Just a quick little walk.
Even when it's snowing, even when there's snow on the ground, I find that just a lap around the block just kind of sets my mood for a better time. I mean, it just kind of resets me for the evening or the morning.
Yep. Also having set times when you're going to connect with friends or family, right? So, okay, Wednesday mornings we take a walk, or Thursday evenings we're going to Zoom, or if there's a social group that you can connect to, a church group, those things are really helpful as well.
Okay. All right. I'm trying to think of my one thing this weekend. I think I'm going to wrap presents, and that's exciting. It's going to be a lot of work.
Yeah. And so it's like, can I also put on a movie? Can I also have my favorite drink? Can I also do things that make it more enjoyable?
Okay, Dr. Ryan, you're so great. Thank you for being
My
here.
pleasure.
I really appreciate it. Nystrom and Associates provides care in the fields of psychiatry, psychology, family therapy, and more. They have 20 locations in the Twin Cities. They work with couples, families, and people of all ages. Now, if you're struggling with stress, anxiety, depression, or addiction, reach out to them today. Well, next up, we head back to Sam's Christmas Village in Wisconsin. We're going to show you how they're taking s'mores to a whole new level. Twin Cities Live will be right back.